Next, let's square up health. New U.S. federal guidelines focus on anal cancer prevention for people with HIV. A newly released set of federal guidelines created significant LGBTQ plus attention because it aims to combat anal cancer among individuals with HIV, marking the first U.S. recommendations on this crucial topic. Developed by the U.S. Department of Health and Human Services panel on the prevention and treatment of opportunistic infections in adults and adolescents with HIV, these guidelines emphasize a screening program utilizing high-resolution anoscopy, HRA, to detect and treat precancerous conditions. The guidelines advocate for annual assessments of anal abnormalities in all HIV-positive adults, including digital anorectal examinations. For those under 35 with symptoms or abnormalities, standard anoscopy is recommended. Individuals 35 and older who are men who have sex with men or transgender women, and those over 45 with HIV should receive lab-based screening followed by HRA if needed. The guidelines draw from the evidence, including the anal cancer HSIL Outcomes Research study, which demonstrated that HRA significantly aids in preventing anal cancer. HRA offers a more precise examination compared to the standard anoscopy. Though it's available remains limited in areas where HRA is unavailable, continued use of DARE and standard anoscopy is advised for symptom assessment. The details in this report are very technical and vitally important for the LGBTQ plus community. For further details, visit Clinicalinfo.hiv.gov. Listen, we've all been battling with HIV virus for many years, and thanks to advancements in treatment, people are now living much longer with HIV. It's crucial to stay in care and follow the recommendations, especially as we learn more about aging as long-term survivors of HIV. Prioritizing your health care is essential to continue achieving amazing things in your life. Sadly, many of us have lost loved ones who didn't have the same opportunities for long life that we have today.
Completely, Vaughn. I mean, and if a new federal guideline is lowering the age, then we should follow suit and make sure that people are getting tested and making sure that they know their status. They lowered the age of colonoscopies for people who have a history of cancer in their family. Right. It used to be like over 50 and now it's like under 40. They've also lowered the age of mammograms, with a history of cancer in your family. So we're just trying to take care of you folks. That's all we're trying to do, knowing your status on anything, even from COVID to anal cancer, just right there extends your life, I mean, get the meds needed, get the care needed, know your status, share it with the people that you sleep with.
And how many times have we seen things in our community, if it's caught early enough, it's taken care of, versus how many times have we heard they waited too long?
Well, and this to me is also part of the wake-up call of this story. How long has HIV/AIDS been around? How long has this been a propensity within people who are HIV positive and in any kind of stage in the disease? And it's 2023, and there is now a study. And there is now guidelines. So just don't think for a moment that I think as an LGBTQ plus person that your healthcare is at all in the priority of kind of the establishment. So pay attention to research like this. And I just also want to say, I really love that this is it's an actual study, that has been peer reviewed and been published and has recommendations and is recognized by the federal government. So when it comes to your health or to issues out there, don't say that you've researched because you went to Google. This is what research really looks like. And I wish it was here so much sooner, but I'm glad it's here now.